here we have Dr. Shruti Vyas joining me for this first edition of Heramba Health Tips. It is important that we live a healthy life, and that starts right from our foot. So, as a podiatrist, Dr. Shruti Vyas, while you are joining us, allow me to request you to tell me what made you consider podiatry as your chosen path to serve.
So, one cool thing about podiatry is that when a patient walks into the office and leaves, 70% of the time they feel better immediately. You can provide immediate relief for patients just from that one visit. Whereas with other doctors, you have to sort of do a long term um, thing. Another thing is you spend a lot of time on your feet, and being a podiatrist, you can develop a lot of preventative measures. Um, and that can help in the long term. Okay, so when I say preventative measures, I mean a lot of our patients are diabetic that have neuropathy or some sort of vascular disease, and we can stop it from progressing and for them to end up with an infection or an amputation, and that's pretty rewarding.
Yeah.
So.
Now let's look at some of the common problems that people face as far as pain in the foot is concerned, and right from the bottom side we go towards heel. And here's a picture that you shared. Tell me about this.
So that's one of the most common reasons people go to the podiatrist office. That's called plantar fasciitis, and that basically is inflammation of the plantar fascia. Now, the plantar fascia is a band that's at the very bottom of your foot, and it basically holds all the muscles together. Over time, when we're walking or wearing non-supportive shoes, it can become tight. Now, when it becomes tight, it starts to cause pain in the area where it begins or originates. So that pain, that inflammation, that's called plantar fasciitis.
And what is the cause of this inflammation? Like everybody doesn't have it, some people have it. Is it the way they walk? Is it the kind of slippers or shoes that they use?
Yeah, so everybody's foot biomechanics are different. I mean, I have friends that can walk 15 miles in slippers and others who can't even walk 5 minutes in slippers, you know. So the way that you diagnose your own feet, you take care of your own feet is important. But one rule of thumb that I always share with my patients is get a pair of shoes and bend them in the middle. And if they bend in the middle, then they're not providing any support along your plantar fascia or along your arches. But if they don't bend, then they are giving you that support that you need, and that will more than likely decrease or eliminate that inflammation that occurs in this area.
So that flexibility in whatever shoes you have would help you in
Mhm.
avoiding the possible pain. But once you end up in the situation where your foot is drawing a lot of attention, then what is it that they can do without sort of going to a podiatrist?
I always share my RICE protocol with all my patients, and that's rest, ice, compress, and elevate. You always start off with that. So if you've hurt yourself and it's an acute injury or it's just happened yesterday, then I recommend resting it, icing it, and compression. You can have compression socks or an ACE bandage that helps keep that area stable, and then elevate above the level of your heart. And that helps to bring all that excess blood back down to your heart.
So
So
I'll
that's
go.
step one.
Yeah. So I'll go to the breakup of this step once again. The first
Mm-hmm.
thing is rest. So
Yes.
what do you consider rest? Like you walk at home, or you don't even get up from your bed? You tell that, okay, bring me this, that, etc. So just help us understand the rest. This context means what?
So a lot of patients that have these acute problems, it's because they've been couch potatoes for a long time, and then they've decided to suddenly get up and start walking or start running. So you can't do that. You kind of have to transition, right? Make your way. So when I say rest, I mean don't go running or jogging or you. I mean you can walk around, from the kitchen to the bathroom to the bedroom, but don't go walking marathons or miles.
Some people they want to run marathon. Then what is the specific attention that they should give to their feet to prepare?
So stretching is number one. Stretching your Achilles tendon, stretching your plantar fascia. Those are the two main things. And just strengthening your ankle ligaments. So one way that you can strengthen your ankle ligaments is if you're laying down, just start writing the ABCs with your ankle. So A, you learned that in kindergarten. B,
Okay.
oh, bring that back. And that will help with strengthening. But
So what you,
stretching number one.
mhm. So as they say, what you learn never goes waste. So learning ABCD would also help you in stretching and figuring out how to do it. So let's
Yeah.
say, I like that. Maybe someday we'll have demonstration from you. And and as you mentioned about ice, and that would help in taking care of the inflammation. Correct.
Mm-hmm.
Mm.
Yes. Yes.
So, just for layman, so you have ice in some bag in your fridge that you put, and is there any sort of thumb rule as to how long you keep it and remove, etc.? Or
So what you can do is actually get an iced water bottle and you want to roll that on under your foot. So you roll it right here along the plantar fascia where the inflammation is present. And that will help decrease a lot of that pain that you're having.
so now third thing is compression, and for
Yes.
that you sort of have some bandage or
Yeah, an ace bandage, that's perfectly fine, or any kind of compression sock. They also have plantar fasciitis compression braces that you can keep, and that will keep the compression at bay.
and finally you have mentioned elevation, so maybe you
Mhm.
can put some pillow and have your feet up resting.
Yep.
The image looks good actually, and I think it helps people in feeling good also. I think somewhere.
Yeah. A lot of our patients are diabetic, and a lot of them have neuropathy or some sort of vascular disease. And one thing with gangrene is people don't have enough circulation going to their lower extremity or to their foot. So when you don't have enough circulation, it's like watering the grass, right? If you don't water the grass won't grow. So same thing here. If the blood doesn't come to your lower extremity, doesn't come to your toes, then those toes don't get enough nutrition. And if they don't get nutrition, then they die. And that is what gangrene is. It's death of the tissue. Now, the tissue is your skin. It could be, and it extends down to your bone. So in that case there, you can see there was an ulcer at the bottom of the foot. And that ulcer was more than likely the entrance of a lot of the bacteria that's around us. When the bacteria enters the body, which it's not supposed to, it starts creating havoc and it starts eating it up and it starts killing those tissues. And that can result in having foul odor, redness, increased swelling, increased pain. All of those are symptoms of infection. So before it gets to that point, podiatrists help to prevent that, prevent you from having an amputation, prevent you from having infection in your bloodstream. So
In addition to biomechanics and whatever medical knowledge that is needed, there is an element of creativity also involved in looking at the possible options and sometimes probably consulting with others too.
one thing that you learn as a surgeon is that you should be prepared for the worst case scenario. That's probably one of the main reasons that they have us look at other surgeons and watch them throughout all these years, because they realize, okay, if someone, let's say for an example, if someone starts bleeding heavily, what are ways you can stop the bleeding? Or if a nerve is cut, what can you do to repair it? Or if there is a worse deformity than you thought it was based off of x-ray or CT, but it looks different clinically, what are things you can do at that moment in order to give them the best possible outcome from that surgery? So
Absolutely. So thank you. And here's one more image with.
yes.
So what this finger is pointing here?
So this is a neuroma, and a neuroma is basically a ball of inflamed nerves that can occur when you're not wearing supportive shoes. So usually what happens is there are nerves that run on your feet and they bifurcate in this area where that picture was pointing to. So the area of bifurcation, that's where the inflammation is occurring. Ways to prevent it is, again, going back to the rice treatment, wearing supportive shoes. There are cortisone injections that you can also get. And then, of course, surgery. And the surgery requires you to remove their neuroma entirely if it's not resolving with any of the conservative treatment options.
So while it is important to have sound feet, and while it is important that you enjoy walking and running, and you have a wonderful life where there is no pain and no sorrow, but that doesn't happen all the time, and sometimes we need to pay attention to certain tips that might help and may prevent our visit to a doctor. And that's what at Haram Health Tips, in essence, we are trying to look at. And I appreciate you joining us, Dr. Shruti Vyas ji from Virginia Beach. So as we conclude, you would like to repeat something or any tip that you think may be helpful for a kid who is interested in athlete and athletics. So there is a lot of running around, and so any advice in terms of the kind of shoes or something?
Yeah, so number one, stretching is the most important thing, I would say. Stretch before and after your workouts. Wearing supportive shoes makes a big difference. Sometimes, not all shoes are good for everybody. You know, everybody has different feet. Another thing is orthotics are something that are helpful as well. Basically, what orthotists do is they make a mold of your foot in a optimal position, and then you get insoles that you can put into your shoes, and they help you walk better and align you better. And then for diabetic patients, I would say please check your feet daily, check in between your toes, dry in between your toes, make sure you have proper nerves and proper vessels.
Yes, as you mentioned, whether your skin is sensitive or not, that means there is consciousness and intelligence in our whole body. It is not just that mind is, of course, the key player, but all our skin, wherever you see, it is we are full of intelligence. So when the skin becomes insensitive, then that intelligence is not activated and it doesn't reach our mind. So let us stay healthy, let us stay intelligent also. What do you say?
I
Agreed?
like it.
Okay.
Exactly.
So thank you very much once again. We'll probably be talking more, and we'll see where some tips may help as far as preventive measures are concerned, not just for foot but maybe for in some other areas also. So once again,
Absolutely.
good wishes.
Thank
Thank you.
you.
Bye.